baby, what I really want to say.
9:19. Welcome back to our daily show. Jamie Goble in the studio. How are you doing?
I'm good. How are you?
So you have been at this for since 2018, and really, when we talk about Medicare, it's such an important conversation to have because I'm sure there's so many question marks whenever a client calls you, and there's so many different nuances to this industry too.
Yeah, a lot of people don't know what they're actually eligible for.
Right.
Some people can get extra benefits like vision, dental, hearing. It just kind of depends on the person. Help with their medications, stuff like that.
Well, and honestly, that's where I find it fascinating because I know of some people that might have Medicare, but they don't actually have the Medicare plan that's right for them.
Correct.
And you see them kind of getting into some trouble with medical bills and things like that because of, not really knowing all that information.
Right. And they don't know who to trust.
Yeah.
Which is understandable.
Well, and whenever you're working with your clients, I think that's I think we want to start with is what's that first phone call look like? Because I'm sure that's kind of be nerve-wracking for the client and also great for you to kind of get to know who they are.
Yeah, some people feel more comfortable over the phone or even going to their house. You just kind of got to feel where they need the most help, whether it's their doctors, prescriptions. You have to go through some important information with them to figure out what's right for them.
Well, and I'm sure you have to stay up to date too with, any changes that are, getting rolled out or any potential changes. And is that something that you have to do quite often?
Every year you have to get licensed with all the carriers to figure out what the changes are for next AEP. Yep.
That's fascinating. See, I don't know too much about the the background of this, so I'm learning with everybody else today.
Yeah, it's a lot.
Well, and now you're going to be having some upcoming workshop lessons too, or workshops, and really just I don't want to call them seminars, but really a place where people can learn, and really get the ins and outs of this. And now, what was the idea behind having these events?
Just information events so they could, make their own decisions on what's right for them. Just kind of get the word out there. There's one June 25th, July 30th, and August 27th here in the RiverBender at 6 p.m.
Really cool. And now, do we need to RSVP ahead of time?
Yes, you can, to my phone number. It's the 618-225-7967.
Absolutely. And, Jamie, it's pretty impressive when you have 145 five-star reviews on Google.
Nice. I didn't even know that.
I'm looking right here. That's pretty impressive. Jamie was absolutely awesome. Is one of the latest 5 stars.
Awesome.
Well, and what's it mean to know? Because this is when you're talking Medicare, it can go one or two ways for people. I'm sure you have the great experiences and then you have the not so great experiences. So to be that person to where you can be the reliable source and really help these folks, it's got to feel great too.
Yes, because it's hard for them to understand. It's like so different from normal insurance.
Well, and now take me through that. Whenever somebody's really getting to that point where we have to understand what Medicare is, what's the best way to really get the information without being overloaded?
Well, I would just, if you call me, then we can set up an appointment and sit down and go over all your information. Just bring your doctors and your medications and just go through all the plans and really take my time to get to know what's the best plan for them.
Well, and now does anyone under 65 qualify?
If they've been disabled for 2 years, then they can apply for Medicare, and then they might be eligible to get it.
Well, and now this is a silly question too, but how do I know if I even do qualify for Medicare?
You would have to, if they're receiving Social Security benefits, you would just have to contact the Social Security office and talk to Medicare and see if you're eligible.
Okay. Well, and now so let's say I wasn't on the right plan last year. Can you change plans once that enrollment period starts, or how does that work?
Sometimes right now there is special enrollment period, so you can change now.
Oh, wow.
So you're not stuck.
See, that's what I was curious about, because I know that if you have the opportunity, I don't think I got the right path forward for me, you can still have some time to call Jamie and let's get this figured out.
Yes, you can.
How often do you meet with clients, in that initial kind of in the initial steps when you're figuring out the plan? Is it kind of a one-day scenario, or do you give them some time to think about it? Do you guys come back and circle back to it, or what's that process look like in the timeline?
Sometimes they make up their mind right then and there. Wow. Sometimes they need a couple days. Sometimes it may be more than that. You never know.
That's interesting. What got you into Medicare?
Well, I actually did medical collections, and then a girlfriend of mine started doing this, and I already knew some of the insurance background through my own own medical journey, and my mom is 92, so I was helping her through it. So it just became a passion of mine.
Really cool. Well, and I just think it's really a needed service, because you're right. There's so many different times where you have folks that they really just don't know who to trust. And whenever I think it's a testament is when you have all these different folks that are saying, no, Jamie, took care of us every step of the way, you know. And going into this too, what are we going to learn in these upcoming events? How long are they? And can we ask a ton of questions during it, or is it best to kind of gather some information, then talk to you afterwards?
Well, it's probably going to be about an hour.
Okay.
You can ask questions then, and then you can also set up an appointment with me later, and we can do a one-on-one.
Really cool. CJ, how do I do that online? Well, I'll take you right there. Listener, thanks for asking. You can go right over. This is the correct website,
That
correct?
is it.
Medicare Insurance Techs.com, and you just click the call us button, and you're good to go, or the contact form, and you can start moving forward. And I really like the fact that you guys have some already FAQs on there on your website, so we can get some background before we pick up the phone and call you too.
Exactly.
Well, and now whenever you're working with Medicare patients, I'm sure it's a wide gauntlet of individuals with all different types of needs and ages. Is there ever, do you ever have just a high volume of just one specific demographic, like, you know, just people that are normally healthy and just need this Medicare to keep moving forward, or is it folks that kind of have some different things going on mostly?
It's a little bit of both. I would say right now it's mostly people that are Medicare, Medicaid people. And then during like AEP, which starts in October, it's more of a mixture.
Really? What's just because I'm not too familiar with it, what is AEP?
It's our open enrollment. So
that makes sense. Well, and what's
annual enrollment period.
What's the difference between Medicaid and Medicare?
Medicaid is through the state. Medicare is federal.
Oh, I'm learning a lot today. I'm actually learning a lot. I love this. Well, and this is what I think is so fascinating, because I can only imagine that there's so many folks that know the words Medicare and they know Medicaid, but when they call, the information just kind of loses out of or slips their mind, because they really don't know too much about it. It's just kind of something we've heard over and over for years, and then when we start, it's like, oh, it's our turn now.
Yeah, and in the state of Illinois, if you have a chronic condition and you have Medicare and Medicaid, you can get a food benefit. In Missouri, if you have both, you can get a food benefit. So they could be missing out on a lot of different benefits.
And see, that's what I'm really fascinated by too, because there's some folks that I've talked to where, you know, maybe they just didn't sign up for the right plan, and all of a sudden they're like, man, this is ridiculous. I can't afford this, you know. And it's not because the plan, it's not because Medicare is bad. It's just we didn't sign up for the right thing. And does that happen quite often?
I have run into people that's happened to. They're not on the right plan, or their medications weren't covered because somebody just wanted to switch their plan just to make money off of it.
That's interesting. Well, do you have a moment to stick around? We've already been talking for 10 minutes. It's flying by. Do you have a moment to stick around so I can pay a bill? Sure. Cool. We'll take a quick break. We'll come back with Jamie and learn more about Medicare, and learn more about ways that we can get over here, meet her for that hour, and learn all this information. And a question, can not really guardians, but can the younger, the children in the parents' life, maybe if they're having some, you know, mobility issues or can't make it, can the supervisor or the individual in charge of that, can they come just by themselves?
Yeah, they're POA. Yeah.
Really cool. Awesome. We'll take a quick break. It's 9:27. We'll come back with Jamie, and we'll learn more about Medicare Insurance Techs and ways that you can be a part of these really great opportunities coming down the pipeline. The first one on June 24th?
It is.
Oh, I'm getting good. I'm remembering things today, Jamie.
Right.
How about that?
Oh, June 25th.
God dang it. Oh, I got to take a break. We'll be back.
Throughout all life stages, you need someone in your corner, guiding you on your health and wellness journey. At OSF Healthcare, that's your primary care provider. Your OSF primary care provider is there for every stage of life. Find a provider today at osfhealthcare.org/primary.
Since 1993, Sparks Junk Removal is always adapting to the needs of our clients. That is why we now offer weekly trash pickup for selected areas. Plus, we offer driveway-safe rubber-tired dumpster rental. Give us a call today at 618-781-1407 or visit us at sparksjunkremoval.net.
When I got in the car accident at the ER, they gave me a prescription of hydrocodone, and over time, it took more medication to mask the pain. I moved over to drug seeking and found heroin and fentanyl. I went to the Centerstone rehab facility, and it was the best decision I ever made in my life. I have my own car, I have a job, there's nothing holding me back anymore.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Welcome back. 9:30. We're learning more about Medicare. And Jamie, thanks for stopping by today, and really excited. And it's one of those things where I was kind of nervous talking about it because I don't know anything about Medicare, you know. But I figured if I don't know, and if I can learn while I'm younger and help the older adults, or at least have a basic line of information, that's great for everybody. And that's what I think having you on the show is great too, because I'm sure there's a lot of questions that people have.
Oh, yeah.
Well, we were talking a little bit about this prescription scenario. And, you know, just because there's some folks that I know that, you know, had to get some prescriptions that was just astronomical. And it was like kind of eye-opening where it's like, whoa, I didn't realize that bills could be that high, you know, for medicine. Why is that? Because we were talking a little bit about that during the break.
So this year they did away with the donut hole, which meant that they lowered the prescription max out for seniors to $2,000. But when that happened, most of the plans came with drug deductibles for tier 3 and ups. So if you had like Eliquis, which is a blood thinner, normally $47, you would have to pay the deductible $420 or whatever your plan said, plus the $47. So a lot of seniors were going January 1 to pick up that medicine, and they were just shocked at the price.
Yeah.
And then next month it would go down to the $47, and then when you hit the $2,000, then it would be $0. But if you make under $1,900 on your Social Security check, I could sign you up for extra help, which would help pay for the medications. They could get it, you know, for $4 or something really cheap. Or if they weren't able to do that, we could call into the carrier and then have a payment plan.
That is really fast. And this is something that I think a lot of people are running into. And it's good information to know, especially if you're, you know, kind of managing your parents a little bit and trying to figure out, whoa, what happened here? It'll all even out, hopefully, in the end, right?
Yeah.
Well, and when you're working with folks too, how important is it to know their lifestyle habits when you're getting to know them? Does that come into play when you're looking at Medicare plans or anything like that, and just their health, overall health?
Well, most of the plans they're trying to make them stay active by having gym memberships and stuff on their plan. So they're trying to keep them active. So it gets to be real important for their health in the long run.
When you're working with, when you're first talking to them, does like lifestyle come into play when you're looking at plans for them or anything like that? Or is it just because there's tiers and you just kind of follow the guidelines? Does that make sense? Like,
it kind of depends on. So if somebody has a chronic condition, it could be eligible for a chronic plan.
That's so fascinating to me. And this is why it's one of those things that kind of just blows my mind, because there's so many spokes on this Medicare wheel that you really have to be fine-tuned with.
Right, and it changes every year.
Well, and going back to what you said, where you're really, I mean, you're going back and you're reevaluating and getting you're testing, right, once a year?
Yep.
And you are partnered up with quite a few different carriers too. Take me through some of those.
So there's United, Essence, Cigna, Aetna. I'm probably forgetting a bunch of them.
Oh, Humana's on there too. Yeah. Well, and see, that's good to know. And what does that mean too when you're having these carriers partner up with you? Is that just one of the providers for that patient potentially, or that client?
Yeah, so I would look at all the plans. So you just put it into the program that we have called Simply Enroll, and it basically puts all their drugs and their doctors, and then it just basically tells me the best plan for them.
That's really
according
cool.
to their drugs.
Well, and we were just talking before the break, and during the first half of this segment, coming down the pipeline on June 25th, now that I remember the date correctly, you can be a part of really just a great hour of learning and getting some great questions asked. And now, when you're going over the different parts, the ABCs, if you will, of Medicare, what do they mean? I'm just going to ask you.
Okay, so you have to have Medicare A and B to be on a Medicare Advantage or a supplement plan. And then the Part D is for drugs.
Okay.
So
Really cool. Well, and now going into this too, how important is it to kind of, for your clients to know, really just having a little bit more information on this? How is it important for them to kind of study up too and realize what they have? Because it's great that you're doing this for us, and we know that you're knowledgeable, but should we be looking at our plans too, throughout the year?
definitely be proactive.
Really?
For sure.
And now, when's the next hour opportunity coming up? Because June 25th's one, and you have one in July, don't you?
Yes, I do. It's July 30th.
And now, how do we RSVP or register?
You can call me to RSVP at my phone number, the 618-225-7967.
Really cool. And now, how many can you hold?
I don't know how many you can hold down there.
That's a good size. That's a good size
big.
room. Well, the point is, if you're a POA or if you're somebody that's turning 65, I mean, what better time to learn this before you actually need to enroll? You know, do you advise people that are in that kind of in between or transition stage to start looking at
it
these?
now?
Yeah.
Yes, definitely.
I could see why. And now, so Part A and B doesn't cover everything, correct?
No.
Like when it comes to like dental and things like that. Is that where the C comes in?
So yeah, Part C has the Medicare Advantage that has the vision, dental, and hearing on it.
That's okay. Now I'm starting to put all this together here. So you need to have A and B to get to C, correct?
Correct.
You're making this easy for me today, Jamie. Thank you so much. Because I was telling folks upstairs, I'm like, this is one interview I actually know zero bit of information on. And if I can learn it at 25, then I think folks can learn it at 18.
You got a ways to go.
Well, and now, whenever when's busy season for you?
Oh, busy season. It starts in October.
Whenever the open enrollment period happens. Yeah. Well, and now can folks call you ahead of time and say, I know that there is a period right now where you can change over, correct? If you're not in the right plan, is that what you're saying?
Yeah, it's a special enrollment period right now. So usually you can qualify for that. And then October, it's annual enrollment period, and then that stops. And then in January, open enrollment goes until March.
Oh, wow.
So where you can switch from one Medicare Advantage to another Medicare Advantage. So it just keeps going. So if you're not in the right plan in January or February and you want to move, you can move.
And you can do that now. Mm-hmm. And what's the phone number again to call you and set up that appointment?
618-225-7967.
Well, and now whenever what's important for your potential clients to know ahead of that first phone call or that first appointment? Is there anything that we need to kind of gather, any data or any type of information?
Yes, so they would need their Medicare number. Of course, I hope they remember their date of birth, mailing address, medications, doctors, stuff like that.
Very fascinating. And Jamie, before I let you go, we've been talking for 20 minutes already. You are annihilating this segment. I've been happy to have you in the studio because it's important information for folks to know.
Right.
Because I feel like it's one of those things, I keep going back to this, where we see it on TV, we hear the word, but we really don't study it. It's just something that we kind of know is there. And then when we turn 65 or we need it, it's like, oh, wow, we got a lot to learn really quickly.
And it changes all the time.
Gosh, I don't know how you stay up with it, to be honest with you.
Well, it gets difficult because it keeps changing.
Well, and now, this isn't a political thing at all, but you have to kind of monitor what the budget, or if they're going to change anything to Medicare, federally every year. In the budget.
Yeah, it kind of depends on who's in office. Sometimes they make cuts or changes to it.
That's very fascinating. This whole thing is. And now June 25th is that first opportunity. You can call and register today, or you can also set that time up in July, or just call Jamie now and say, hey, I need to learn and I'm ready to work with you.
Exactly.
Well, and Jamie, before I let you go, what's one or two more things you'd like for folks to know about what you're doing, your services, and just Medicare in general?
So it doesn't cost anything just to have a conversation to know if you're missing anything. That's the most important thing. I'm not going to pressure anybody into anything. But to just get the information is the best way to go about it, because you could be missing out on a lot of stuff.
Well, and I feel like there's people out there that definitely are in the area. And I really encourage you guys to pick up the phone and call Jamie, because I'm telling you, I learned so much in 20 minutes that I know that you're going to learn even more in this hour coming up on June the 25th.
Exactly.
Well, and again, you can register for this if you're a POA or if you're someone that's 64, turning 65 next year. What is 64 kind of a good, if you're in that age range, to stop by and learn?
Yes, because they're getting ready to turn, so they'll get all their information ahead of time.
I am liking this. We're being proactive.
Exactly, proactive.
Well, and Jamie is a neighbor to us at the RiverBender building too. Can they stop by your office, or do you do pretty much virtual consultations?
Oh yeah, you can stop by. You can stop by. You can call me. Whatever you need to do.
Awesome. Well, Jamie, thank you so much for stopping by. This has been a great segment. We'll link everything in an article on RiverBender.com, and we'll make sure that you can get all the updated information on when you can be a part of these classes, these hour-long, really great learning experiences at June the 25th and in July. We'll take a quick break. More Daily Show comes right around the corner right after this in the heart of the 618.